oh, I do need to check heart valves or heart sounds, but they will forget, I need to maintain the privacy. You missed this, and I'm gonna deduct maybe 1 point for that. Molar pregnancy actually means we can say false pregnancy or fake pregnancy.
So extra eyes, extra
Yes.
hands.
Extra hands.
Okay.
The hired 8 of my students, some of them are still working there. You have 4 red tomatoes.
Okay.
Which one is more red?
Oh.
I was crying. I remember me and my husband, we actually went to that place. Not a patient anymore because he was dead.
Welcome back to another episode of The Making of a Nurse. Today's podcast is a special one. It's about the nursing clinical.
It's great to have you here and
Thank you, Cindy.
meet you in person. Yeah. You are in charge of clinicals for vocational nurses.
Yes.
Yeah. So what are clinicals and why do we need them? I mean, don't nurses just go to school and then go visit a hospital and start working or something? I mean, what's with clinicals?
So clinicals actually are a very crucial part of, VN or any kind of nursing course.
Okay.
Because clinicals are actually a bridge between their didactic and hands-on.
Okay.
So with clinicals, basically we mean that whatever we teach them in their didactic courses, they have to implement that or they have to learn that in a clinical setting, that how to perform those, those tasks or those skills,
So they're studying,
in a practical setting.
all week long.
Yes.
And then you have them go at the end of the week. You said they study 4 days. Then they go at the end of the week to practice.
Yes.
And do they practice just kind of at random, or are they practicing the exact skills that you've been teaching that week?
So definitely not random. We actually have, proper criteria. We have syllabus for each module.
Okay.
So by the way, with module, I mean semesters.
And there's 3 modules, yes?
4.
4 modules.
So for VN, we have 4 modules and each module is 3 months.
3 months
So it's
for
12
each
months.
one. Okay.
Yes.
All right.
So the very first module, when they're in first semester, they have, as you mentioned, they have didactics from Monday to Thursday. And on Friday, they will implement or they will learn those skills in a skill lab. So we are not sending them to the clinical sites when they're in first module.
And the skill lab, if you've explained to people, is high fidelity mannequins
Yes.
that are simulated so that you have a pretend patient presenting with systems equivalent to what you're studying, yes?
Yeah.
Okay, so they go from didactics to the sim lab with the high fidelity mannequins and then to the real patients under supervision.
Yes.
Okay.
But we don't even directly start with high fidelity in the beginning. So as I mentioned, that we really have a very organized curriculum. In the beginning, they will actually practice very basic skills. And you can laugh to this.
Okay, tell me a really basic skill here.
With very basic, I mean, they even need to start learning from how to make a bed.
How to make a bed.
How to make a bed.
Wow, I could be a nurse after all.
How to make a bed when you have a patient on bed and when you don't have a patient on bed.
Oh, wait a minute. It's getting a little harder here. So you have to make a bed with a patient in it without a patient.
Yes. Yeah. So we call it occupied bedding and unoccupied bedding.
How do you make a bed with a patient in it? Oh, maybe tell us later.
That's what they need to learn. That's what they need to learn. Yeah.
Okay, so they're learning how to make a bed.
Yeah. Because remember, we have patients, who are bedridden and they cannot even move. They don't have any mobility.
Okay, so in bathing, are they learning how to bathe the patient in bed too?
They need to learn that, how to sponge bath. They need to learn how to wash their hands with the appropriate steps.
Okay. So
and
hand washing.
Yes, hand washing.
I think it was what? The birthday song?
Yeah,
you sing
happy birthday, so that you can count your minutes,
Yes. Okay.
Yeah. And then slowly and gradually we will take them to more complex procedures, like they need to learn how to give injections. And then there are various type of injections. We have intramuscular, subcutaneous injections. We have insulins. So they have to learn, how to give injections to the patients while they are working directly with the patients later on.
And this is all in module 1.
Yes.
So module 1 has a trajectory that's kind of complex because you're
Mhm.
going all the way from bed making
Yes.
to different various kinds
Yeah.
of injections.
Yeah.
Okay.
Yes.
Okay.
Yeah. Even they need to learn how to feed your patient with a, if they are not able to eat orally, how to give them a feeding through G tube, how to give them a care if they have tracheostomy. So all those complex procedures will be there as well.
But they are not doing it without supervision.
No.
And I talked to you earlier. It sounds like you keep them on a pretty short leash. Yes?
Yes.
Okay.
Yes, we do. While they are in didactic, we only require one instructor, who can teach 40 students. But when they are in their skills, we do actually make groups, and depending on how many number of students you have in one class, let's say if we have 40, maybe we will put 10 students with one instructor.
Okay.
And they will take their turns or there will be rotations.
And the way that looks is you're at the clinical site with them or someone supervising them
Yes.
at that site, making sure that student and instructor are together
Mhm.
and working on the patient under your supervision.
Yes.
Okay.
So it's not me, it's my clinical instructors. Yeah. I go there, I visit them at least once a week. Yeah. So once a week, I will go to, any facility to visit them, what they are doing, to see their progress, if they are learning, But yeah, I do have a clinical instructor with them, and we try to give them not more than 10 students. So that, our instructors actually have enough time to focus on each and every student. Yeah.
Then what is module 2? I think we understand module 1. They get to do injections and they're a little more complex in their procedures. Tell me what module 2 covers.
So module 2, now we are teaching them medical surgical basic. With medical surgical, I mean, we are actually teaching them in didactic about the disorders. Let's
Such
say about
as?
GI disorder, any disorder, any disease related to gastrointestinal,
Okay.
maybe about liver, right? And then now they are going to their clinical sites twice a week.
So
Because
they're
that's the
studying
requirement.
didactics and instruction
Yes.
3 days a week.
3 days a week.
But now
Yes.
they're going to clinicals 2 days a week.
Yeah.
Okay. So
Yes.
that's greatly enhanced their clinical time now for
Yes.
that. Okay.
Because our hours are actually from the board. We have to be very compliant with the hours. And then the requirement is 18 hours a week. Yeah. So that's why we are sending them twice a week there. And since you asked about module 2, I would really like to mention this, that, when they go to the clinical sites, not that, directly from the beginning, of their rotation, they will start giving medications to the patient. No, it doesn't work like that. They have to pass this exam. We call it
Okay.
dosage calculation exam.
So basically, they're
How to
looking
convert.
at pharmacology
Yes.
with mathematics.
Mathematics.
And they're becoming experts at that
Yes.
before they give out those doses.
Yeah.
Okay.
Yeah. They need to know all the conversions.
Okay.
Yeah.
And side effects, are they learning side effects as
Yeah.
well?
They are learning side
Okay.
effects. There is adverse effect as well.
Yeah, that would be important to know
Yeah.
if someone
Yes. So
strokes out on you. or
Exactly,
something.
exactly. Because the difference is that, you don't have to report side effects because there are side effects from the medications. But adverse effect is something which is not common. If you notice any adverse effect, you have to report that right away to your doctor.
Okay.
So yeah, they do learn that, and then once they pass their dosage calculation exam, which actually we conduct in second week of their rotation, once they pass that, then slowly and gradually we will put them, in medication administration. But again, they are not supposed to do it by themselves.
Okay.
They are under their instructor. They are working under their instructor or registered nurses there or other health professionals, Definitely not by
Supervision-
themselves. Yes.
Supervision being the key word, I think,
Yes.
here with the clinicals.
Yeah.
Okay.
Yeah.
Then are they ready for module 3 at this point, or do you have to take
Yeah. So our rotation will be
Okay.
12 weeks.
12 weeks?
12 weeks.
Okay.
And then again, as I mentioned earlier about head to toe assessment. So this is one exam which regardless, in which module they are, they will have to pass it in each mode.
Okay.
Yeah.
Okay.
So again, before they go to module 3, during week 11 or 12, we try to do it on 11 so that we have 12th week, which is a little bit relaxed. Students usually have potlucks with their instructors. They have these get-togethers with other groups as well, and then instructors can work on their final evaluation.
Okay.
Are they now well prepared to go to module 3, right? So yeah, they have to pass that head to toe assessment exam again. And of course, we do have all these assignments, so instructors need to see that if they are done with all their assignments as well.
And that head to toe you were explaining before we were filming is in 15 minutes.
Yes.
Can you explain that to everyone here? So they're literally analyzing from head to toe.
Yeah.
Everything that could possibly be wrong with a patient, and they have 15 minutes. And you said they're not necessarily healthy patients.
No, they're not.
So they're assessing them, recording that, and
Yes.
you're assessing their assessments to see if they're catching if someone has something wrong with them.
Yeah. So
that must
actually
get kind of interesting.
Yeah, it is. So basically my student is not documenting at that point because their focus is also on, that, oh, I need to finish this in 15 minutes, right? So they are just going with flow, they are doing that starting from head, they will go and check their ears, their eyes, their nose, for any drainage, epistaxis. Meanwhile, they will be asking questions from their patients as well that, if you have any complaints you want me to address at this point, because I can always go and ask your nurse or your doctor about that. Then of course they will check their oral cavity, for thyroid gland. They will check their heart valves, sounds, abdominal sounds, lung sounds, from back and from anterior part as well.
So why is it 15 minutes? Is that because of insurance?
This is how they...
Like insurance plans within doctors' offices can bill in 15-minute increments? Is that the reason, or is this...
I don't know. It's not from doctor's office. Yeah, definitely not. But this is how they just...
visit. Okay, no.
This is just for our schools, you can say for exam point of view, that you have this time, this is your timeline and you should be done within this 15 minutes.
Okay.
Yeah. So basically it is just timed like any other exam, that, oh, you have these 15 questions you have to finish in an hour, or you have 50 questions you have to finish this in 2 hours. So this is just a time.
Got it. Okay. Yeah. Have you seen anyone really get their assessments wrong in this 15-minute?
I would not say wrong, but sometimes they do miss, some basic points. So students always remember those big things that, oh, I do need to check heart valves or heart sounds, but they will forget, I need to maintain the privacy,
Curtain wide open.
Exactly, which is also crucial, right?
Yeah, bedside manner gone.
Exactly.
Yeah, okay.
Exactly. So we need to remind them always as an instructor that, oh no, you missed this, and I'm going to deduct maybe 1 point for that. So you just have to remind your students.
And you were saying you have to enter from the right side in case the patient wants to stand up. So you're grading them on which side of the bed they're entering for their bedside manner as well.
Yeah.
Okay. So they might forget something like that in the process.
Yes.
Okay.
Yeah.
Okay. So then are they ready for the next module now? Okay.
Yes.
What does that look like?
So module 3, now we have, as I mentioned earlier, that, in module 2, they have medical surgical basic, right? But now in module 3, they have medical surgical advanced. With advanced, I mean, now we will teach them these complex disorders, coming from cardiac, let's say angina or, any heart disorder. And then another one is endocrine, like your thyroids, right? And then maybe cancers. So all these complex disorders, we will teach them in didactic courses. And then if we were going, to long-term facilities in Mod 2, now we will, maybe put them in a skilled nursing facilities or maybe post-acute nursing facilities so that, they see that kind of patients there.
Okay.
Which will help them, of course, in their growth and, skill set as well.
So we might say they're getting into specialty areas or niche fields at that point.
The only specialty we have in Mod 3 is mental health.
Okay.
Yeah, mental health. And we actually have one of the clinical site, where they see patients, with Alzheimer's, with dementia. Yeah, they do work with all those patients.
Okay.
Yeah.
Very complex at
Yes.
that point. Okay.
Yeah.
And then what happens after module 3?
So after module 3, it comes to module 4 now, when they are almost graduating students, and then now it's time when we have more specialties.
Okay.
And we have OB, yeah, and then pediatric nursing as well.
Okay.
And that's the time, as I mentioned earlier as well, that in Gurnik we always integrate the courses. So if they are learning OB and pediatric nursing in their didactic, we will put them in the clinics which is specific to OB, right, or which are specific to pediatrics. So I was actually visiting one of the clinical site, and then my students actually observing. So they don't always do procedures, but they also observe procedures. Of course, being a nursing students, they cannot perform pap smear, right? But they can always observe these physicians doing it. Yeah, and we are really thankful to those clinical sites, who give those chances to our students. So yeah, one of my student was observing pap smear, and one of my student, he mentioned in the classroom that, oh, Ms. Smriti, I actually observe this ultrasound, and that mother actually had molar pregnancy.
Oh.
Molar pregnancy actually means we can say false pregnancy or fake pregnancy.
What does that manifest like? How are you pretend pregnant? Like,
so actually they have all the symptoms like they are pregnant. They will have nausea, they have vomiting, they also have abdominal growth, but they are not pregnant because that embryo actually never grow after that.
So an embryo's there.
Embryo was there, but after that it should change, right? It should grow, but the growth actually stopped there. Yeah. So now if you will do the ultrasound, you actually will see that there is a grape-like structure.
Literally.
Yes.
So this is not
a pregnancy
daytime
anymore.
Television here. This really happens.
Yes, this really happens. And the interesting fact was that I was actually teaching this to my students in a classroom, and after 2 weeks they mentioned that they were so excited. Oh, Ms. Smriti, you know what we saw in the clinical facility? And I was like, what? And they were like, we actually saw a patient with this. So
do
that really gives them idea.
Too? Do they look pregnant?
Actually, that was very early. That was, I think, that that women's very first ultrasound. So you don't have that much growth by then, right? But they do tell them that of course they have to terminate that. They have to clean it. They have to perform the procedure called DNC. And then they do tell them that do not get pregnant for at least next 1 year, because there is a possibility that you can have that again. Yeah, so they actually tell them to do those pregnancy test kits. So they recommend them that you have to monitor it for next 1 year.
Wow. Okay, well, back to the clinicals. That's a case in point, though, because you had just taught that, and then they saw that.
Yeah.
And
so I really like it, when my students actually get chance to see that.
The textbook lesson was reinforced with the real life.
Exactly.
And then they were very interested in it. Yeah. Okay, so then at module 4, then they're ready to go into exit exams now?
Exit exam, we actually have a month of classes, when we offer them, when we actually teach them about, what NCLEX is, how your exit exam will be. So So now it's the time, in that 1 month, we will cover all the courses from module 1 to module 4.
So what are the benefits to clinicals for the students and the clinical that's hosting them? Is there any benefit to the clinical that's
I think even
them?
the name, the name itself has an answer. We call them LVNs, right? Or practical nurses, right? So I really don't think that, they can be a full-fledged nurses without doing these practicals. Because they will not have those skills, without doing that.
They just would not even know what they were doing. Okay, so how does a student coming to Gurnik prepare for the clinical? Who want to take a clinical, what do I do? How do I prepare for that?
So how we prepare them for clinicals is that, when they're in module 1, As I mentioned earlier, that we are not sending them to the clinical sites, of course, right? But we really want to start already in module 1 so that they have 3 months of timeline, right? Before they go to the clinicals,
Okay.
right? So that they don't make excuses, because students are students, right? They will be like, sometimes they don't take things seriously, so we really want to give them those 3 months to prepare for that. And with the preparation, I mean, the very big piece or main criteria is compliance. They need to be compliant to go to the clinical facilities, because they have requirements, right? So requirements like background check.
Okay.
Yeah.
See if there's anything you don't know about them.
Yeah.
Yep.
True.
Okay.
Yeah. Background check. They have to have this CPR done, right? And then they should have all their immunization done for TB, for Tdap, measles, MMR.
COVID.
Yeah, COVID.
Okay.
Yes, nowadays. Yeah. They should have all their dosage done.
Okay. So background
For COVID.
checks,
Yeah.
immunizations, and CPR.
CPR.
Okay.
Yeah. So we will check all these things. We will start checking that already in module 1. So by the time they need to go, we are ready.
Okay.
Yeah.
And what is the benefit to the clinical host? What's the benefit to them? They got these students running around.
I think it's a great help for them as well. They have some hands, some extra hands, who are working for them. Even from module 2, at least they can help them with the basic things like checking vital signs. So that really saves their nurses' time. Their RN's time, that meanwhile students are doing the vital signs, they can give a list to them, and they can give it back to them that nurse, this is the list I have, for your patients, I'm done with the vital signs, and they can go from there now.
So extra eyes, extra
Yes.
hands.
Extra hands.
Okay.
Yeah.
And maybe they learn something by teaching. Like they say you never know something until you've taught it.
Yeah.
So
Exactly.
maybe that's
And
a
also,
piece
I
too.
think it also helped them to probably hire them later on, because I'm sure even students are now very comfortable working in that particular clinical facility, because that's where they were having their rotations.
Right. And we can't make any guarantees, but a lot of students come back and say, they were hired in their clinical
Exactly.
places.
And I would love
Yeah.
to mention that here, that there was a time when I was also working as a clinical instructor in Gurnix, probably 2 years ago.
Okay.
I used to take my students to one of this nursing care facility, and then they actually hired 8 of my students.
8 of your students?
8 of my students.
Wow.
But yeah, they hired 8 of my students. Some of them are still working there with them, And then, and after that, they are also working. Some of them, they are already pursuing their BSN.
Excellent.
Yeah.
Yeah.
So
Excellent.
I think this is something, which will help companies as well.
So we've unpacked today a lot of stuff. We've unpacked what a student learns in those modules. We've unpacked some benefits to the students. We've unpacked the benefits to the clinical hosts. And can you tell me, in sort of wrapping it up, how a student changes from that first clinical to the end?
Wow.
Like, what do you see?
I love that question because, it's kind of, as you asked that, how I see their growth, right?
Yeah, what do you see?
Yeah.
You see these scared students walk in and suddenly they come out.
Yeah,
nurses.
If you remember, I was telling you about these skills classes, right?
Yeah.
Which they do when they practice on these mannequins, right? They do this basic stuff. This is actually one of my favorite class. And the reason that's my favorite is because that's the time they are like, they don't even know the basics, Maybe some of them do, those who are maybe working as a CNAs or MAs, right? But we also have students, or the population who just graduated from their schools, right? They literally don't know anything, right? So if you see their growth from that module 1 to module 4, that is kind of, it really gives me satisfaction, And I do remember when I was a kid, my grandfather used to tell me that I really want you to be an educator. And I was like, no, that's so boring. I never want to be an educator. And that's true. But I love it now. I really love it now, you know.
Maybe you had seen education as, at the blackboard or something. You hadn't
Blackboard,
seen
and
it
you
as
know,
innovative.
there was one thing in me that I always want to serve people. I always want to serve people around me, you know. And then I truly believe that if I am working as a nurse, maybe I'm not able uh, to give it back to the society that much. But if I am working as an educator, right, how many students I'm teaching, right? Maybe I can take care of 5 patients in a day. But if I am teaching 40 students at a time, all those 40 students will go around.
Yeah,
And how many patients they are
exponentially.
covering,
Exponentially,
right?
yeah.
So that is something, I'm having these goosebumps right now, but that is something really satisfies me. And I love to be educator.
What would you tell students that are wanting to go into a clinical and they're still in high school? What would you tell them to try and remember and learn and prepare for that?
There are actually, you know, some specific criterias which we really like to tell them that you need to focus on that. Prioritization is very important. Critical thinking is very important. You know, if they have a patient, there is a joke, nursing joke actually. You know,
I was wondering if you were going to tell this.
Yeah. So there is this nursing joke that you have
For priorities, right? Okay.
Yeah, for priorities. You have 4 red tomatoes.
Okay.
Which one is more red?
Or you have 4
Right.
red crayons. Which one is more red?
More
So in
red.
other words, all the tasks of a nurse are pretty
Uh-huh.
urgent,
Exactly.
but you have to discern which is the most urgent.
Exactly. You
to
have to
attend to.
prioritize that which one
Yeah.
need attention. So we need to teach them, you know, that which can kill your patient. You want to prioritize that patient first, right? Maybe you have a patient who is having a chest pain, and you have a patient who has maybe pain in their stomach. But patient is saying, I have pain 10 on 10, right? But do you want to prioritize stomach ache, or do you want to prioritize angina,
Which one?
right?
Yes.
So which one you want to prioritize? Of course, you always want to prioritize a chest pain, right? So this kind of stuff we really want them to learn, and we really want them to learn how to apply their critical thinking, whatever they learn in their classrooms, how to apply that to the patients now.
So prioritizing and critical thinking is something that they could do now to get ready for clinical. Excellent. You had told me a humorous story of when you were a nursing student. Can we share it here?
I will. So yeah, that story is from when actually I was a student nurse back in
2 times. Yes.
back in 2009
In India.
in India.
Yes. And
Yeah.
then again in America.
Yeah.
So you've done this twice. Good job.
Yeah, thank you.
Okay.
Thank you. Yeah, I actually graduated in 2012. But yeah, let me come back to the story. So, yeah, I was a student nurse in 2009. Would you believe that I was actually checking a vital signs of a patient? Not a patient anymore because he was dead.
How did that go for you?
So, yeah, I was actually assigned by my instructor to check vital signs of maybe 10 patients. And that was my patient, you know, assigned for that day. And I was putting him the cuff, you know, blood pressure cuff. I was about to inflate that, you know, when actually the doctor came and he was like, wait, Smriti, what you are doing? I was like, I'm checking the vital signs. He was like, could you stop? And I thought I'm doing something wrong, and which I was. He took me aside, you know, of course he doesn't want to mention that over there. He took me aside and he was like, do you even know that the patient is dead? That was funny, but I was really embarrassed, you know. I was like, you know, oh my God, I maybe I lose the trust now. My doctor will be like, you know, that you don't even know that the patient is dead. But to me, I was thinking that probably the patient is unconscious.
Love it when you tell me stories and I can tell them out here. You have your students make beds,
Mm-hmm.
sometimes with people in them and sometimes without How do you make a bed with someone in it?
So yeah, we actually call this occupied bed. So occupied bed means that, as you mentioned, that when a patient is actually on the bed, right? Because we have different kind of patients. Maybe we have patients, who cannot even move, who don't have any mobility. So students not just need to know that how to just make a simple bed. That might, maybe you know that already before nursing, right? But you need to learn now how to make bed when your patient is on the bed, right? How to, which of course they cannot do it by themselves. They definitely need some assistance, right? They can ask their CNAs or maybe their partner for that day, right? That, oh, can you please help me? So of course one of them, do you want me to tell you how to do that?
Yeah, how do you do that? I want to know.
So
Then I want to see the B-roll.
it's just we call it like rollover. They have this bedding, they have this bed sheet, which they actually, it's rolled already, right? The partner of my student, whoever is assisting, will maybe move patient towards herself or himself, right? So that she can actually spread it from that particular side, and then they will roll over the patient towards other student, and then they will tuck it to the another side.
And then tuck them in.
Yeah, tuck them in, make mitten corners.
Excellent.
Yeah,
Wow.
because there is actually a way how to tuck it in, not just that, okay, you will tuck it in how you do it at home. You have to make proper mitten corners.
Correct. Yeah. And
Yeah.
they're hospital corners, we call
Yes,
them in
they
the
are
US.
hospital corners.
So now we know how to make a bed with someone in it.
Yeah.
Excellent. One story you told me when we were interviewing that made me actually respect you more was you were really vulnerable about something, and we were relating test taking. And I remember you told me, I'll let you tell it.
Are you talking about NCLEX?
I am. Yes.
Okay. So yeah, I was never a bad student, I would say, in India. There was a time when I have to give this exam, just to get that job, and I actually had good numbers, that I was able to give an interview, and then to pass that and to work in that hospital.
Which meant you did very well. You're
Yes.
not going to say that, but
Yeah.
I know you had to be pretty prestigious to get
Yes.
in there. So you're smart. We got that.
Yeah,
Okay.
because my rank was actually 80th among 8,000 students. So
You were one of 8,000 in India.
Yeah.
Good job.
yeah. And then I actually came to States in 2018.
To take the NCLEX.
In 2018, and
Okay.
then I thought I was always a good student, so it's okay, I can do this as well, right? Not realizing that the way NCLEX conduct exam is completely different what I had in India. Because in India we still had these essay writings. Yeah, so NCLEX was I would say completely different word to me.
And we had a discussion about the multiple choice.
Yeah.
And often there's a little trick. One little word
Yeah.
can change the whole thing.
Whole
And
thing.
so here you were with the NCLEX,
Mhm.
the multiple choice. So we want to tell students what?
Yeah.
Don't give up.
Yeah, don't give up, because and I always share this with my students, and I have no shame about it. I don't like hiding stories as well, because I really believe that students will learn something from your stories. So I did exam in 2019, which was my first attempt of NCLEX, and yeah, I didn't made it. I think I knew even before I gave exam that it will be hard for me, because I don't even know what NCLEX is. But still, I didn't thought that I will not make it. And I remember after giving the exam, because even in India I was an educator, so at least after giving that exam, I already realized that how it went, how I did. I was crying.
Oh.
I was crying. I remember me and my husband, we actually went to that place, we took a bath and we were going back home. I was still crying, and he was so scared that people will ask me why your wife is crying. So he was telling me that, oh, please stop, and maybe we will go somewhere. And so yeah, it was pretty vulnerable experience to me. I remember I went India after that for 5 months. was very depressed, because I never faced failure before that. Yeah, so I think that was the big piece.
And now you've passed it, and
Yeah.
your word to students would be never give up. I'm sure.
Would you
right?
believe? Would you believe? Next time, when now I know how to prepare for exam, I only studied 23 days, and 24th June was my exam. Yeah, and I made it. And I don't. At that point, I was so relaxed. I wasn't nervous at all. I felt like that. Oh, I'm just practicing questions. Yeah, so that's why I always share it with my students that never give up. At least you guys are studying here. We are already getting you ready for those exams. So it's way easier for you than it was for me.
And the whole last part really
Yeah.
is getting ready for the exit exams and the
exam.
NCLEX.
Yeah. So yeah, I always tell them that if I can do it, you can do it.
Good for you. Thanks for being vulnerable with that.